ladies and gentlemen. My name is Tanya McCormick. I will be discussing prevention and staging of pressure ulcers. I currently work in home health as an LPN. My day-to-day operations consist of treating and preventing skin breakdown. I hope by the end of this video, you will understand how to prevent and stage pressure ulcers. Okay, let's start by asking, what are pressure ulcers? According to the Mayo Clinic, pressure ulcers are areas of damaged skin caused by staying in one position for too long. They commonly form over bony prominences such as your ankles, your heels, back, elbows, your coccyx, and hips. People who are at higher risk for pressure ulcers are people who are bedridden, people who are in wheelchairs for long periods of time, and or people who are unable to reposition themselves frequently independently. Pressure ulcers can cause serious infections, some of which are life-threatening. It is easier to prevent a pressure ulcer than it is to heal one. A pressure ulcer is categorized from stages 1 to 4. Then you have suspected deep tissue injury, and then you have an unstageable pressure ulcer. Let's start by discussing stage 1 pressure ulcer. The skin is intact with non-blanchable redness of a localized area, usually over a bony prominence. Darkly pigmented skin may not have visible blanching. Its color may differ from the surrounding tissue, though. Stage 2 pressure ulcers has partial thickness loss of the dermis, presenting as a shallow open ulcer with red, pink wound bed. It will be free of slough. It may also present as an intact or open ruptured serum-filled blister. A stage 3 pressure ulcer is a full thickness tissue loss. Subcutaneous fat may be visible, but bone, tendon, or muscle are not exposed. Slough may be present, but doesn't obscure the depth of the tissue loss. The wound may include undermining and tunneling. Stage 4 pressure ulcers is a full thickness tissue loss with exposed tendon or muscle. Slough or eschar may be present on some parts of the wound bed. It often includes undermining and tunneling. We also have suspected deep tissue injury, which would present itself as a purple or maroon localized area or discoloration, intact skin, or blood-filled blisters due to damage of the underlying soft tissue from pressure or shearing. The area may be painful, firm, boggy, warm, or cool as compared to the adjacent tissue. Lastly, but not least, is the unstageable wound. It has full tissue loss in which the base of the ulcer is covered with yellow, tan, gray, green, or brown eschar, which is dead tissue. Preventing pressure ulcers require frequent repositioning to avoid stress on the skin. Performing good skin care daily, maintaining good nutrition and fluid intake. If you use a wheelchair, try to reposition yourself about every 15 minutes. If you're unable to reposition yourself, please ask someone to reposition you every hour. Use specialty cushions. Use specialty mattresses on beds to prevent pressure points or pressure ulcers. Performing good skin care daily is very important to keep the skin clean and dry. Also, perform good skincare in between incontinence episodes. Patients should not sit in soiled depends of stool and urine. This will cause an increase in skin breakdown. Lastly but not least, properly assess skin daily for signs and symptoms of skin breakdown so that the early detection will help with prevention and treatment. Thanks and have a good day.